Welcome to the P.A.S. Report podcast. If you're tired of censorship, outraged by government abuses, and thirsty for real insights, then you're in the right place. Get ready, because here, the fight for freedom never ends. Here's your host, Professor Nick Giordano.
Welcome, everyone, to the P.A.S. Report podcast. This is your host, Nick Giordano. I'm glad you could join me. Make sure you follow and subscribe to the podcast so you never miss an episode. Also, visit the P.A.S. Report website, pasreport.com. Sign up for the newsletter and share this episode with your family and friends because I have a fantastic guest coming on today. I have Johns Hopkins University professor and Dr. Marty Makary joining me. He's the author of the brand new book, Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health. And it's an important conversation that we need to have, especially in light of everything that's been going on for the last 4 years, but even before that. So Dr. Makary, thanks for coming on. I'm glad you could join me today.
Great to be with you, Nick. Thanks for having me.
Well, I mean, obviously, I'll start off with the elephant in the room. So I want to make it clear, your book goes well beyond COVID, but the pandemic is an important part of the book. And that's where I do want to start, because in Blind Spots, you talk about the idea of medical groupthink. And in political science, when I teach groupthink, particularly in international relations, it usually has really bad outcomes. So can you just tell the audience for a minute what you mean by medical groupthink and give an example of how we know it, how we see it, and the detrimental impact it has?
Yeah, Nick. So groupthink really has a whole psychology behind it. It's being intellectually lazy, failing to question deeply held assumptions, and just going with the bandwagon mentality. And that sort of herd mentality thinking has done a lot of damage in medicine, not just during the pandemic. That's a small part of the book, as you mentioned, but it's really a peek into how the medical establishment has operated in the modern era. It's the same bandwagon thinking that gave us the wrong recommendation that fat caused heart disease and people should switch to low-fat foods. It's the same bandwagon thinking that gave us the wrong recommendation that opioids were non-addictive, igniting the opioid epidemic. Same thing with peanut allergies. The medical establishment about 24 years ago gave the wrong recommendation for mothers and young children to avoid peanuts altogether in order to prevent peanut allergies. They got it perfectly backwards. The avoidance ignited peanut allergies and the modern day peanut allergy epidemic. And it does beg the question, could it be that many of our modern day health crises have been caused by or hastened by the hubris and arrogance of the medical establishment? Certainly COVID is one example where you can actually look at the entire COVID nightmare. 20 million deaths, an economy that's still recovering, intense poverty, disproportionate downsides to poor and minority communities. The entire COVID nightmare may have been avoidable. The entire thing could have been prevented had scientists not been messing with a bat coronavirus in the laboratory. And so it does beg the question, in the pursuit to try to do good things in medicine, are we actually, is groupthink doing tremendous damage? And I think COVID was just one sneak peek into a broader medical establishment.
Yeah, I mean, I certainly agree with that. And I want to get to the allergy thing in a minute because I have a kid that suffers from allergies and thankfully he grew out of most of them, but there's still a few. But when we look into the coronavirus and the coordination between the government and the medical community, the healthcare industry, it was disturbing, right? I mean, you had schools being shut down in some cases for nearly 2 years, children being masked up with no evidence that's going to help. In fact, I used to work in emergency management, did pandemic planning, and we never, ever would even think of universal masking or anything like that. And then you had adults telling children that they're going to be responsible for grandma and grandpa's death. You know, when we're looking at the youth, how much damage was inflicted on young Americans that's going to last for decades as opposed to the coronavirus? And are you upset when you see people like Dr. Fauci, Randy Weingarten, Governor Gretchen Whitmer come out and say, oh, well, we wanted to get the schools open as early as possible. We were pushing to get those schools open, when in reality, they were the ones that had them shut down?
Well, Governor Whitmer's comments are particularly disturbing because Michigan and Sweden have the exact same population and the same percentage of elderly people in the population. They had the concurrent seasonality of the COVID waves. They hit at the same time. So it wasn't like a New York to Florida comparison where you had different timing and medical treatment got better over time. It was at the same time. There is no more like apples to apples comparison of COVID policies than Michigan compared to Sweden. In the end, Michigan had about double the deaths with the strongest restrictions. And of course, the
You couldn't
restrictions were
even buy
harshest.
paint. You couldn't buy paint.
The schools were closed for almost 2 years there. And what I see missing from all these people that you mentioned is an apology, any sign of humility. It wasn't just, hey, we got to make a quick decision because it's an emergency. For nearly 2 years, kids were shut out of schools. Adults had their bowling alleys and their bars, but kids who are defenseless and don't vote paid the worst penalties. And ultimately, the data were very clear early on and are today that a young, healthy kid has an infinitesimally small risk of any health problems from COVID. The risk of a healthy child dying of COVID is essentially zero, and yet they paid tremendous. But why have they? Why is everyone getting promoted up after making these catastrophic mistakes, ignoring natural immunity, forcing toddlers to wear cloth masks for 3 years, pushing boosters, 6 doses of a COVID vaccine in a young, healthy, thin 12-year-old girl, insisting on these recommendations with such absolutism when it was really just based on a gut feeling they had. It wasn't based on science. So
Well, the
that is
ones
what
that did
bothers
have
me.
science behind them, they were censored, right? Because the government was saying they were putting out misinformation when it turned out that people like yourself, people like Dr. Bhattacharya, you guys were the ones that were right.
And our own government was out there reaching out to social media saying, censor these people, censor these ideas. And when I would talk to public health officials privately, and I'd say, you know, we have this giant study on natural immunity out of my institution, Johns Hopkins, published in the top medical journal, showing natural immunity is strong and durable. They would say, yeah, Marty, it's obvious. We know that, but we can't say this publicly because basically people are too stupid to understand it. And if people then misinterpret it to think we want to try to get COVID to get natural immunity, they may not get vaccinated. In other words, it may create vaccine hesitancy. Therefore, that's why we're censoring you. And that kind of arrogance, it defines not just a medical elite that is highly politically connected, but also a ruling class in America that lived large during COVID. They had some great years doing Zooms in their pajamas and making money and sending their kids to private tutors and going to the country clubs. Meanwhile, come to inner city Baltimore, where I work, and you will see that pandemic was, the restrictions were brutal. And so it really showed us a lot about the ruling class in America.
Yeah, absolutely. I look at it from the perspective, you know, they said stay home, stay safe, and it showed their ignorance, not realizing that not every child comes from a safe home, and so you just basically lock them up with either a parentless household where they're going to run wild or an abuser, you know, domestic violence situation. It was really disgraceful. But you point out to the people in the medical community that were saying the arrogance there. Do you think part of that arrogance, and I know you've seen this over the years, where we're watching private practices just disappear, and we're seeing these large health corporations absorbing all these doctors from the private practices. Do you think that has something to do with what's going on today?
Well, many of the rank and file doctors that I know and talk to nationally who agree with almost everything that Jay Bhattacharya, myself, and many others have been saying the entire pandemic on all the topics, they're good people. They think independently, but we have a small group of people in medicine making all the decisions at the top. It's a centralized authority living in a bubble connected to the academic ivory towers, and they've done tremendous damage. They've shown no humility. And COVID was just really one snapshot into how the medical establishment works. Why have we made almost no progress in cancer in 30 years? Why are we not talking about food as medicine? Maybe we need to treat more diabetes with cooking classes than just throwing insulin at people. Maybe we need to treat more back pain with ice and physical therapy instead of putting people on opioids and doing surgery. Maybe we need to treat more high blood pressure by talking about sleep quality instead of just throwing antihypertensives at people. Maybe we need to talk about the environmental exposures that cause cancer, not just the chemotherapy to treat it. We need to talk about food as medicine. We can't just be pushing Ozempic on every young obese child in America. Maybe we need to address school lunch programs, body inflammation. These are the giant blind spots of modern medicine. It's why I wrote the book. There are these important topics in health that we are not talking about that we should be talking about. And it's the same hubris and arrogance of the medical establishment that has made so many mistakes in the modern era, from igniting the opioid epidemic to the peanut allergy epidemic, from separating babies from their moms for 50 years, they got that wrong, from pushing the low-fat diet, they got that wrong for 60 years, from denying postmenopausal women hormone replacement therapy because some NIH Yahoo said it caused breast cancer when it never did. I mean, 50 million women have been denied the health benefits of hormone replacement therapy after menopause because of that guy and that announcement. There are so many areas of health where people are not getting the true story, and they can tell something ain't right. People
Well, I
feel
mean, one of the
comfortable.
things that you just brought up was, and you focus on it in your book, was the idea of body inflammation. I think that's really important because it turns out that, my oldest son has a wheat sensitivity, but he could actually eat pasta from Italy that's made with an Italian wheat, but he can't eat American pasta that's made with American wheat. Why is that?
Well, we've got a different food supply in the U.S. It's controlled by big food industry. It's nutrient poor. It's developed with soil that's not even real rich soil that you see in other parts of the world. And we sell, I don't know, we know what to call it. It's not even food. It's sort of like plastic and compounds and other products. And we push this stuff and then wonder why we have an epidemic of celiac and inflammatory bowel disease and a whole host of diseases that didn't exist before the modern white coat era of the post-World War II time period. Um, One of the studies I looked at in the book, Blind Spots, was at the Mayo Clinic. Kids that took antibiotics in childhood had higher rates of obesity and learning disabilities. And you might think, why is that? It's not directly from the antibiotic, we think. It's the antibiotic carpet bombs the microbiome, the garden of millions of bacteria that line the gastrointestinal tract. And that garden of bacteria in everybody's gut shapes the immune system, produces serotonin involved in mental health. It's involved in digestion, produces vitamins, regulates estrogen. So there's this giant organ system modern medicine has ignored, and it's highly impacted by what we eat, by these unnecessary antibiotics that people take, by unnecessary C-sections. And people need to know the truth about health when it comes to the microbiome and gut health and how it connects to overall health.
And another part of the book that you bring up is that really the American healthcare system is based on maintaining, not curing, but just maintaining. Why? Why doesn't it focus more on actually resolving the issues? There's some that believe because it's a bunch of greedy people that are looking to make more and more money. Others believe it may be due to incompetence. But what have you found in your research?
Well, I appreciate you bringing that up, Nick, because I think we attract good people in medicine. If you look at the folks that apply to medical school, they're very altruistic. 90% of them want to do medical missions in some part, even part-time, added on to their practice once they become a doctor. At least they say so when they start. And then we take these intelligent, creative, altruistic people and we beat them down and we turn them into robots and we force them to memorize millions of medications and their indications. And they come out with this reflex and even burn out sometimes. They come out different people after 8 or 10 years. I could see in myself that culture of medicine tugging away at me the whole time, thinking, Don't ask questions. Just do what you're told. Just obey. Just, survive. And we do this to our own type. And so I think we have good people in healthcare working in a bad system. It's a system we inherited where we're told to get on a hamster wheel and see patients quickly in 10-minute visits and throw meds at them, and then spend time billing and coding. And what are we left with? A system where patients aren't happy, doctors are burnt out. A lot of people are becoming millionaires off this system, sieving money out of the system.
And
We got
many
a
of
lot
them
of
aren't even
waste.
doctors.
A lot of millionaires who are not patient facing. And some of them can help us with our businesses and processes, but there's a lot of leeches in the system just sucking money out. And the money in healthcare is the largest business in America. It is being financed on the backs of everyday American workers through their paycheck deduction. If everyone looks at their paycheck, there's a part deducted for their health insurance and a Medicare excise tax, and they're not going down. And so people are funding this giant system where everybody's getting rich, pharma, hospitals, all the stakeholders, insurance companies. But the one stakeholder that does not have a voice in Washington, D.C. is the American worker who's funding this crazy system. Instead of just playing whack-a-mole with chronic diseases, we need to prevent disease and talk about health, not just sickness. We need to talk about food as medicine, the microbiome, the new areas of research. We need to spend time with patients when we see them and not just rush them through and throw meds at them. We have the most medicated generation in human history. We're in the process of converting America's children into a generation of patients, sometimes by the medicalization of ordinary life. We're making no progress in some of the major problems in healthcare, like cancer, and you look at chronic diseases. It's stagnant. It's been getting worse. It used to be that African Americans in the 1950s and 60s were the healthiest population in the United States. Now it's completely flipped. No one is talking about food and health and how we can address the real needs of people. Instead, we're putting people through pill mills, and we're left with this giant healthcare business where everybody says we just got to throw more money at it. And I don't believe that's the answer. And that's why I wrote the book Blind Spots. I think we can talk about health and not just feed this system of playing whack-a-mole as we continue to medicate people into oblivions.
Yeah, and everyone focuses on the cost of health insurance. It's like, no, target the cost of care and look at the whole apparatus. I mean, one of the things that it's been reported on lately is the amount of increase in cancer rates amongst millennials, that at a younger age, they are developing cancer, particularly colorectal cancer is the one I keep on saying, but other cancers as well. And so obviously our environment is not all that healthy. It's not conducive. But in your book, you talk about blood tests and how there's a number of blood tests that people should be getting, but doctors aren't ordering it, and nobody's making sure that insurance companies are paying for it. What type of blood tests are you talking about for the audience?
So everybody, and if they've got a paper and pen, they can write this down. When you go for
Or they
your
keep
blood
rewatching
tests,
the episode a million times.
or watch it, I like that. There are some blood tests that everybody should have that are not routinely recommended. Only maybe 5 or 10% of doctors perhaps may recommend these tests. And everyone should have an LP little a, or lipoprotein A. Turns out it's one of the most powerful predictors of heart disease. Instead, everyone's told, oh, HDL, LDL, good and bad cholesterol. That is far more imprecise than an apoprotein B, what we call apolipoprotein B, and the LP little a test that I just mentioned. So those are two tests for starters, and I mentioned others in the book, that people should get. So next time you get a set of blood work, ask your doctor, if you haven't already had it, for an lipoprotein A and an ApoB blood test. And those are probably some of the best predictors of who needs aggressive therapy to prevent heart disease and who may not need to be on a statin or, reduce the fat intake in their diet. One of the recommendations that we've gotten tragically wrong in America, it was probably the number one thing we told patients for 60 years as doctors. Avoid fat. Next to stop smoking, that was probably the number one thing we told people. We got it perfectly backwards. It's refined carbohydrates from simple sugars, not sugars in fruits and vegetables and nature, but refined sugars that are not bound to fiber, and ultra processed foods that are messing up the microbiome. You mentioned the colon cancer going up in young people. It's a big concern. Nobody really knows what's going on. But actually, in my book, I'll tell you exactly what might be going on. Studies have found higher rates of colon cancer in young people among young people that were born by C-section. Why? Because when you're born by C-section, your microbiome is different. You're extracted from a sterile operative field, and instead of the gut, which is sterile at birth, being seeded with bacteria from the birth canal, instead it may be seeded from bacteria that normally live in the hospital. And so we have clues as to why cancer is going up. We just need to pursue it. And you're hearing, even in the political debate now, folks saying, hey, we were supposed to have the cure for cancer by now. Where is it? Like, we've really not made a lot of progress. And if you look at the way the government funds research, it's worse than how the government funds the Postal Service. I mean, they fund these small incremental ideas and little tiny discoveries with a ton of red tape. Meanwhile, people need, we're not funding the big ideas. We need to get people with big ideas on how we can address the big blind spots of modern medicine, the topics I talk about in the book, and fund those researchers. And there's a bunch of them now. And they're getting funding from private philanthropists, but that's where we're going to cure disease, not from our little incremental games we play with the NIH. We've got to challenge deeply held assumptions in medicine and in science. That's always how we have made discoveries.
Yeah, I mean, and it's you look at it today, besides the cancer, we're seeing increasing cases of early onset dementia, and my mother at 48 was diagnosed with it. It's one of the most horrific diseases you could imagine. I mean, I know but it is horrific. And so the lifestyle changes. A lot of it, not only is it that you talk about in your book, not only is it healthier, but it's actually also cheaper, right? I mean, you look at purchasing produce and eating produce and fresh fruits, that's cheaper than a bag of Doritos that stains your fingers orange.
Yeah, I mean, look, there's a lot of discussion of drug pricing out there in the political arena. The best way to lower drug prices is to stop taking drugs we don't need, right? We have this over-medicalized society right now driven by this sort of pharmaceutical, medical, industrial complex. You mentioned dementia, Nick, and just for a second, I want to connect with you on that. I had an aunt who died of Alzheimer's. It was brutal. It's a cruel disease. It turns out that a simple medication taken daily or administered through a patch on the skin called estrogen, it's been around for almost 100 years, has been found in women who go through menopause if they start it within 10 years of going through menopause, reduces the risk of heart attacks in half, cuts the rate of dementia by up to 64%, may reduce Alzheimer's by 35% in one study. These are respectable studies. If a woman falls or is in a car accident, they're half as less likely to break a bone. And breaking bones later in life can lead to a cascade of events that results in immobility and disability and sometimes demise. Here's an incredible medical intervention. Maybe there's been no other medical intervention since antibiotics that improve the health of a population more than estrogen, or what we call hormone replacement therapy, for postmenopausal women. And yet 90% of doctors do not prescribe it because some cowboy at the NIH had a press conference 22 years ago where he said it causes breast cancer when it never did. His own data did not show that. And I go through it in the book, Blind Spots, but it's an incredible story of how a $30 a month medication has profound benefits to the health of women, which is half of the population. And yet it gets almost no mention because of the dogma put out there by one NIH scientist who had done a study that cost $1 billion. It was the most expensive study in the history of government. And he didn't even follow his own results. He misrepresented them because he was so vested in what he had already had as a foregone conclusion. It's an incredible story, the story of hormone replacement therapy for postmenopausal women.
Yeah, don't get me started with the government bureaucrats because they just drive me nuts all day long. It's like you look at government and, at the beginning we started talking about some people like Fauci and Randy Weingarten. It seems like it's the one industry where you could just constantly get promoted as you fail each and every step of the way. I mean, there's no accountability, and we see that day in, day out. But it has real ramifications. In your book, you talk about how 7 out of 10 people used to trust and respect the medical community, the healthcare industry. Today, it's down to 4 out of 10 people. What is the way to reverse that trend? I mean, we can't have a good medical industry and healthcare field if nobody trusts it. So how do they begin to reverse that trend? Obviously, the easiest one is they have to acknowledge their failures over the last, several decades. But how else? What else could be done?
Well, I think that there's a lot of doctors out there in American communities that are still respected. They think independently. They may see a recommendation from the CDC, but they're going to tell their patients, here's what they're saying from the top. Here's what I believe based on my observation experience from other studies. And I still think the role of the American physician is one that should not be sort of forgotten. Doctors are not happy about the central authority that is out there right now trying to so-called police misinformation. If you look at the life mission of the Faucis of the world right now, they are on a mission to so-called battle misinformation. The irony is that the greatest propagator of misinformation during the COVID pandemic was the United States government, pushing cloth masks on toddlers, forcing schools to close, pushing 6 vaccine doses in young, healthy kids, vaccine mandates, ignoring natural immunity, not allowing people to visit their loved ones when they were dying. That's a human rights violation. They were pushing all this misinformation, and now they're curious why the trust level is down. And so I think we do need fresh leadership. We need an apology. We need some humility, and it's not just with COVID. The medical establishment needs to apologize about the low-fat diet. They need to set the record straight on how to prevent peanut allergies. It's not from peanut avoidance early in life. It's from peanut butter introduction in infancy, and milk and eggs and other things early in life. We're seeing this new sort of war on meat lately. Let's take a look at the close data on meat. And it's not what you're hearing about meat being the downfall of Western civilization. I go through that in the book. But when I find as a doctor, Nick, if I make a mistake with a patient, when I find out, I immediately go to the patient and say, look, there's something that went wrong. I'm sorry. I take responsibility. I don't know what happened, but I am sorry. That patient thanks me and says, Doc, thank you for sharing that with me. I really appreciate how you came up here and told me that. People are very forgiving when you're honest, and the public right now is hungry for honesty in medicine.
Especially when the lies are so blatant and when, the way it is, it's amazing, even down to kids. One thing I can't stand is the amount of young boys that they just simply throw on Ritalin, oh, he's got ADHD. No, I mean, boys are hyper. It's not, they're going to be hyper. That's natural. They're going to talk, and sooner or later they calm down for the most part. So it really is crazy what we're seeing. And I think your book is actually a breath of fresh air to see that there are people in the medical community that want to do the right thing. There are people in the medical community that are looking to actually solve the problems as opposed to just maintaining the status quo. So thank you for the book. I really appreciate it. And I enjoyed this conversation.
Thanks so much, Nick. Thanks for having me, and thanks for taking an interest in it.
Thank you for listening to the P.A.S. Report. Don't forget to rate, share, and hit that subscribe button. That way you'll never miss an episode. For more exclusive content and updates, visit us at PASreport.com and follow Professor Giordano on all social media platforms at P.A.S. Report.